Hello, how are you doing? I've just had a treatment with a lovely client of mine, and we had a brilliant chat about how sometimes it's difficult to access your feet yourself, and also it's really hard sometimes at home to ask our partners to rub our feet for us. A lot of people don't like touching other people's feet, and that's perfectly normal. But she suffers from back pain. And I was saying to her that actually reflexology is just as powerful through the hands, not just the feet. So I said, well, if your husband really doesn't want to help you with your feet, he can access three very key and simple reflex points on the hands to help her relieve her back pain for her. So these three key reflexes are the spine reflex. Now, just as the foot from the heel to the toe on the inside part, the spine reflex runs from the wrist all the way up the side of the thumb to the tip. Okay, so by massaging and gently caterpillar walking up the entire side of the thumb, you're accessing your spine. So you have sacrum coccyx, lumbar, thoracic, and your cervical. So a nice gentle caterpillar walk. Okay, so that would be your first reflex. So really give that a good massage. You can also, if I just take my ring off, you can bend your index finger and just do some circular rotations up the side of the thumb there as well, especially where it is that you're feeling the pain. Now, my client has a lot of lumbar, lower back support issues she needs help with, so that would be this area. So you can spend a long time increasing the blood flow, stimulating the nerve endings on the spine reflex there. Okay, so once you've spent a good couple of minutes working the spine reflex, you're then going to want to help with pain management. Now, there's one very important point for pain management, and that is your pituitary gland, which is in the centre of our thumb, and that's the same as the big toe. Okay, so if you can't reach your big toe and your partner at home doesn't want to touch your big toes, you can push in and hold that point right in the centre of the thumb. And I always say to people, hold it for a minute and then release. Hold it for a minute again and then release. Hold it for another minute. Okay, so 3 good long minutes, and also you can pump that reflex area. Okay, very powerful point there for pain management. Okay, and then finally, I want to talk about the neck, which is the base of the thumb, and this whole actual area, this whole midsection of the thumb here. And it's important not to miss the neck out. Obviously, a lot of us, even myself, when I turn, I'm unable to sometimes turn all the way to the side, and I know that if I'm feeling any spinal pain or aches, it's probably to do with my neck. So you want to give the neck a lot of attention, which is basically massaging the whole midsection area of your thumb. So I like to caterpillar walk, because sometimes if you use a caterpillar walk, which is nice and slow, you can actually feel the tension, and you can feel things pop if you are holding any tension underneath. And the more you practice, the more sensitive your thumbs are at picking up these little knots and bumps and bubbles and tension areas on yourself. So you work that whole area of your thumb all the way round. Okay, side, base, tip. And again, you can do the same circular massage motion technique. So if you kind of think spinal support with your hand, it's the thumb and the whole side part here. Okay, zone 1 we call that. And if you do lots of nice self-care and work on both thumbs at the same time, do exactly the same moves on both sides, you're really helping open up, stimulate your spinal reflex and supporting your pituitary gland to help release balancing hormones that help with pain management. Okay, so it might not feel like it. You might think, oh, I'm pushing my thumbs, that can't really be helping me with my pain. You'd be surprised. So that's what I wanted to share with you, because there's always a way that we can get a partner at home to help support us. And the excuse of, oh, I just don't like touching people's feet, don't have to. We can do our hands, okay? We can also do our face and we can also do our ears, but I'll do that another time. So it's lovely to have a quick chat. Any questions? Pop any questions in below. I know a lot of you are at work, you might watch this later, so give me a hashtag replay so I know that you've watched it, and speak soon.